Hello, friends and families. Welcome to the EDUCA DPS podcast, where we inform families and connect communities. My name is Javier Ibarra, your host of the English version of this podcast. Today's topic: according to the CDC website, in 2022, the state of Colorado ranked number 21 in deaths by suicide, with a total of 1,293 people who died by suicide. That is roughly around 107 people per month and about 26 per week, according to the stats from the state on suicide mortality. Today in the studio, we have Dr. Jane Lineman, our student safety coordinator from the Department of Social Work and Psychological Services here at Denver Public Schools. Our topic will be around the conversation of suicide prevention. Hi, Dr. Lineman. How are you today?
Doing well. Thanks for having me.
We are excited to have you back because this is a topic that I feel we've done in the past, right? Because you've been on the show a couple times now. Yeah. More than once, I would say. Years. A few times.
Yeah.
But it's always good to reiterate, reinform. We have new families to the district who might want to have this information, folks who have transferred out. And so I feel that it's always powerful to have you on to talk about this very subject. But just to give our audience some background knowledge, can you please tell us how long you've been with the district and what is the most satisfying or gratifying thing about the work that you do?
Oh goodness, I think I've been with DPS, I think I'm starting my 18th year.
Okay.
I think it feels like forever, and it feels like a blink of an eye. Yeah, a spring chicken. I think everything that we do in the area of student safety is satisfying, because we put students first, right? Yes. We're ensuring that they have mental health wellness, finding success in schools, and just feeling good about themselves, which is kind of the spirit of joy, happiness, right? Which can be defined as any type of success for our students. So anything that we're doing to make sure students have the opportunity to find that wellness, that joy, that happiness, I think is very gratifying.
We talk a lot about a term called the whole child, and I feel like this really fits in, right? If we are hoping and expecting that our students achieve academically, but we don't help them with resources for other aspects of life like mental health, how can we realistically expect that from our students? And so that's why I'm very happy to have folks like you in the district who bring these resources to our children.
Thank you.
So thank you for that. For our audience, I want to give them a little bit of background information. Suicide prevention is a critical public health issue that focuses on identifying and supporting individuals at risk of self-harm. It involves raising awareness, providing education, reducing stigma, and promoting mental health services. Support networks such as friends, family, and community resources play a vital role in offering empathy, understanding, and timely intervention. Denver Public Schools is dedicated to serving the whole child, which we just discussed, by working to ensure physical and psychological safety in schools. All schools work diligently to provide access to suicide prevention programming and community resources. And we're going to link a website link here at the bottom for everyone, and then put it on our show notes so that you too can access these resources. Starting off with our first question, Dr. Lineman, what are the most common warning signs of someone at risk for suicide?
Yeah, so I think it's important just to name anyone can be at risk for suicide. So anyone can be at risk. Warning signs are things that you see or you hear, or things that you observe that really make you go, whew, something's not right. Let me lean into that. Some of the most common things that we see among our children and youth are changes in behavior, changes in mood that are different from what we typically expect. And that can be tricky with teenagers because we know sometimes they experience a little bit of a different mood change. Can also be like physical symptoms such as headaches or stomach aches. Can be a decline in grades, a decline in attendance. independence, not wanting to go to school, disengaging, pulling away from your friends, isolating, difficulty sleeping, changes in eating habits, things again that are different from what we typically expect from our children and youth, and again that make you go, ooh, something's not right. Some of the biggest warning signs that we're going to be talking about death, reading or listening to music about death, writing anything that would suggest that you have a plan to die by suicide, and then of course statements that children often will make, such as, I hate my life, I wish I was dead, or you would be better off without me. So just things, again, that you hear or you see that just don't make you feel good, that you feel like you need to ask more questions.
Real quickly, what are some of the signs that we wouldn't expect that might be there? Because, or maybe you mentioned them, right? Because you said, loss of appetite, loss of interest in things that folks would normally like. I think it's important to highlight that these are signs, but some of them are more powerful than others. But your inkling, which is what you mentioned, is the one that you should listen to and say, something's not right. Let me dig deeper. Let me ask some clarifying questions. And then in this show, we're going to talk about what happens when you have that inkling and you want to be equipped with some resources. But leading us to our next question, how can we create a supportive environment that encourages individuals to seek help when experiencing suicidal thoughts?
So one of the most important things we can do is just keep the conversation going. Right, okay. Which means that you have to create a safe space, a space that children feel comfortable sharing how they're feeling or what they might be thinking, and reserving judgment. I think sometimes as parents, we see our child's behavior and we go, oh, I remember feeling that feeling, it's no big deal. Right. Or one of the most common things that we often will say with our children whenever they have a breakup, oh, there are other fish in the sea, right? Like we use those phrases, we kind of diminish the big emotions that I think our children have. And so it comes back to, if you want to create a safe space, you want to create an environment to where we can be more aware, take things more seriously, which empowers us to kind of rule out if their significant concern is being patient, listening, asking the question directly, and knowing what to do if there are concerns, how to access support and help our children and youth get that whenever they feel like they might need it.
Just real quick, you mentioned on something that I think might make some folks uncomfortable, which is actually addressing it.
Yeah.
I think it's an uncomfortable situation where you have to say, hey, like, are you thinking of harming yourself? But you're saying that this is the best way to move about this. Is it possible that talking about suicide or suicide prevention will put the thought into the student's head? Is that true?
What I would tell you is it's not true. It's a myth. It's in a lot of different trainings. It's in our prevention education that we do in our schools, but rather it provides that space for children to ask a question. And whether that be at home, it be in the community, or it be at school, right? We work with all of our staff to ensure that they are identified as trusted adults, know when they see those warning signs, going back to what doesn't sit well, and then, as you had said, asking the question directly. It is better just to provide the opportunity for a child to share what they're thinking, what they're feeling, being patient, validating their emotions in that moment, and then helping them access whatever that support might look like.
Dr. Lineman, you mentioned a trusted adult, and so that leads me to my next question. What role do mental health professionals play in suicide prevention, and how can they be more accessible to those who need them?
Yeah, I think DPS is a leader in this particular area of work. We have been doing what I call suicide prevention programming in our schools since 2011, way before a lot of the other districts were doing that. And of course, across our states, we're seeing that shift gain more attention and more proactiveness. We also have worked really hard to increase the number of mental health staff in our school buildings to make sure that our students can access those individuals whenever they need to. We do a lot of training with our adults as well. I was very excited this year. It's the first year DPS has released a required training for all DPS staff. And part of that required training is talking about risk factors and warning signs associated with suicide, and making sure that all of our staff are aware of how do you get help if you're worried about someone. And that extends to not just our children or youth, but our adults, right? Because it's a human experience, takes a community approach. And when we talk about training and education, we start with our students. We support our parents with building their understanding, addressing some of that myth that you had referenced parents like talking about suicide doesn't put it in someone's mind, and then making sure our staff also can create those safe and inclusive environments that foster what I would consider a sense of connectedness and belongingness.
What a huge win to be able to include that as part of the training that all DPS employees, because when I think about it, I think the school district employs the third most or second most employees in the entire city.
Say it again.
That Denver Public Schools employs the second most or third most employees out of any organization in the entire city.
I know we're the largest school district in Colorado.
That's right.
And so we have the greatest, what I call a captive audience, to really help build those skills and make sure that people have the tools to know how to support our children and our youth.
Right, and I know that oftentimes children look up to the trusted adult, to see how they cope with certain situations, or even when the instance of suicide or the conversation comes up. Right, they will look to the adult, and if they see fear or whatever the case may be, I think that the children or students in this case will often follow or mimic that. And so I think it's important to also address our adults, because they are part of the entire DPS system experience as well.
Yeah.
My next question for you is, how can schools and workplaces implement effective suicide prevention programs? What successes has your team seen along with this?
So again, going back to something I said earlier, it's a community approach. It means that in every little nook and cranny, every aspect, you have to, in essence, promote mental health wellness. And part of that is suicide prevention. It can be something such as putting up flyers or posters in break rooms for employees, putting them up in restrooms for children or employees if they just need the number to a crisis line. It's hosting trainings during lunch hours that staff can pop into if they want. It's further supporting our district plan to ensure that suicide prevention happens in all of our 5th, our 6th, our 9th, and our 12th grade classrooms, and making sure our schools are providing access to training for our caregivers and for our staff as well. This year, as I shared, is a big step for us to make sure that all DPS staff have just some information to get them moving, because that conversation has to keep going. So finding all the different creative ways. I know there's a number of apps out there that schools are using with children, parents are using with their children. You see 988 widely advertised across our district, across our communities, and our state, to make sure that students are aware, like if you're worried about yourself or if you're worried about someone else, there are resources. You can chat, you can call, you can text, and I'm happy to see the field kind of evolve and make sure that resources are more accessible across all of those demographics.
I think coming from the Latino community, it speaks worlds to making sure that this is no longer a stigma, right? That we are talking about this, because only when we talk about it do we really understand and then have that conversation of, well, there's resources. You don't have to sit there with those feelings by yourself, which can isolate you even more. You have a community and resources like the 988 number that you mentioned, which is the National Suicide Prevention Hotline. Got that correct? And so I just want to reiterate to all of our listeners that there are resources for you. Dr. Lineman, what impact does social media and online communities have on our suicide rates, and how can they be used positively for prevention?
Yeah, so social media is definitely gaining a lot of attention. I know that there's been a number of panel discussions, a lot of trainings out there around the harms of social media. I know the Surgeon General recently came out and talked about the impact of social media, and talking about the mental health crisis in our country. And I think it's really calling attention for people to be better consumers of the social media platforms they might be engaging in, and that starts with parents, right? Recognizing that students are, I do believe, well more versed than us because they use them more often. But again, going back to community approach, our parents need to become aware of what is out there. How do you set some type of parameters or restrictions on a phone or a piece of technology? But also not just restricting, but having conversations. Like, what are you seeing online? When you see this, what are you thinking? What might you be feeling? Saying, I saw you post this online. Tell me more about why you posted this. So not only coming at it from what I consider an educational aspect, like, what exists, what can we do in order to supervise or monitor what that use looks like, but also recognizing people are using social media widely, and sometimes we know and sometimes we don't know, and so opening up that conversation. So going back to that theme, keep the conversation going. Technology is going to continue to evolve, so there's opportunity to do some further exploration, but again, I would recommend in collaboration with your employees, with your children, with your family, with your friends. What are we using? How are we consuming it?
I'm glad that we talked about social media, because I've worked with social media as part of my career for such a long time, right? I help do a lot of the social media here and in past careers. And what I know about social media is the whole point of it is to make sure that you spend as much time as possible on the particular app that you're on. And the algorithm rewards posts that people would want to see or continue to see, and sometimes those posts are negative. And so I think that as a community, we do need to monitor that and then be aware of what we put. I think once I was made aware of that myself, I don't really share a lot of things on social media that I wouldn't say are true positive or true negative. I would say closer to neutral. And the reason why I think is because as a personal standpoint for me is, I don't want to seem as too showing off or like my life is great, because at some point, what if I had some suicidal thoughts, and then everyone's saying, well, he's posting positive things on social media, and so therefore his life must be great, right? And so then it gets hard to see if I have signs or anything, right? And so I think it's the same thing for others, right? Be aware of what you're posting and how it makes others people feel, right? I think if done correctly, social media is one of the greatest ways to connect with people. And it's so interesting when we look at our higher arc needs, if you will. At the end of the day, we just want to connect with each other, right? And so if we do it correctly, then and positively, I think it has a great effect to our children. It's a very deep conversation here. I want to ask, what are some effective strategies for talking to someone who may be contemplating suicide?
So I'm going to go back to some of what I said earlier, right? Creating a safe space. You have to make sure that someone is present, you're listening, you have to validate their feelings. It's their experience. And as you're kind of sharing some of your own reflections, what I hear is the personal experience. You have to kind of reserve that judgment, dispel some of those myths. No, talking about it isn't going to put it in someone's head, but it does open up the conversation. And if you're not the right person to be in the conversation, let's find someone who can be in that conversation.
That's the key.
And help support, right? And there's no harm in saying, I don't know if I can have this conversation. I would rather you name that you don't know if you can find someone who can,
right,
than be scared or fearful of getting into that conversation, right? We don't all wear the same hats. We don't all have the same tools in our toolkit, and that's okay. That's what makes us unique. Going back to also what you said around connectedness and belongingness, that is one of the most important things you can do in that conversation, is provide the opportunity for someone to say, thank you for hearing me. Thank you for being present with me, and then either walk with that person as they access support or help guide them to how they can access support. It can create a relationship of understanding, compassion, empathy, all those different things that you highlighted earlier as really strong protective factors. So be direct, ask the question, and if you can't, find someone who can.
I'm really glad that you're on the show. And then when I think about my suicide prevention journey as a advocate for the awareness, I think that when I first started, I might have been very closed-minded, right? But through professionals like yourself, I'm able to understand. And every time that we have this conversation, I learn something, right? And so I just want to highlight that, because I think that this isn't just okay, you watched one podcast about this topic and now you're an expert, right? Or you watched a podcast about this topic and now you can go out there and prevent. And I think it's important that it's a journey, to outline that it's a journey and that the resources are there. And you said it, the key there was, if you don't feel comfortable talking about it, find an expert, find a resource that is comfortable. Because depending on where that person is on their journey, right, it could be very advantageous to find the expert. Dr. Lineman, my next question for you is, what resources are available for individuals who have lost someone to suicide, and how can they be supported?
Yeah, there's a number of different resources out there that are accessible to our families, our loved ones who have been impacted by a loss of suicide. We might refer to them as a suicide loss survivor. A couple of them that come to mind, the Suicide Prevention Center, the Resource Center, actually provides a podcast, handouts, literature you can read, and can help you also get connected with a support network. And I'm a big advocate that if you can find someone who might be sharing your experience, it can also create a sense of connectedness and belonging for you, often through that grief and loss response that people often experience. The American Foundation for Suicide Prevention also provides a number of the similar resources. I often share that resource when I'm talking with friends and family who don't live in Colorado, because they can provide access to national support groups. And here in Colorado, and I didn't get a chance to say, but I just wanted to name, if you are in a moment of crisis, or if you're worried about someone being in a moment of crisis, we have the Colorado Crisis Walk-in Centers, great resources. They also can refer you to other resources that might help with grief and loss if needed. But if you truly are in a moment of crisis or someone is, please call 911. Our emergency responders are very well versed, able to help support that so that we can avoid the potential loss of a life. And that conversation shifts from what can we do for someone who's been impacted to loss to how can we support someone to getting to a better, healthier state.
Throughout this conversation, we've talked about what is suicide, we've talked about suicide prevention, we talked about resources for folks who are contemplating or thinking about it, and then we've talked about resources for folks who have already lost someone. The next question for you is, how can communities work together to reduce the stigma surrounding mental health and suicide? So
educate yourself. Go to a training, have a conversation. Don't be scared to ask questions, right? Like, we might all not share the same values, the same beliefs, but if something is sitting with you and you might not know, ask the question. What is your experience with this, or what recommendations might you have? You're still, as an individual, going to go back and you're going to have to work out your own values, your beliefs around mental health, and hopefully broaden your understanding that everyone has mental health. Everyone's journey looks a little bit different. Most people are going to have some really great moments in life, and some people are going to experience some really low moments in life.
Right.
But once we can normalize it's part of the human experience, I think we keep the conversation open. And then once you can kind of engage and, as you said, like, educate yourself, right? Learn the warning signs, learn the risk factors. And if you see something, again, it's not sitting well with you, ask the question.
Right.
And if you're not the right person, it's okay. It's okay to ask for a backup or someone else who might be a little bit more skilled or comfortable in a particular area so that they are willing to engage in that. Everyone has a common responsibility, I think. It's my own belief, my own value, to kind of be aware, at least know how to lean in, and if not leaning in, get someone else to lean in to ask questions and make sure that people are able to access care if that's what they're needing.
I'm glad that you pointed all of these things out, because everything that we're talking about, the overarching theme is suicide prevention, but there are multiple ways to look at it. There are multiple ways to prevent it, to talk about it if it's happened. And so it's, again, just a valuable resource. Is there a final message that you have for our audience that you'd like to say before we go? I'm
going to have an ask, because I do believe it's a community approach. So my ask is that everyone who's listening, identify where you're at in your journey of learning how to show up in suicide prevention. If you already have the skills, how are you implementing them with people that you might see in a moment of crisis? If you are very well versed, how are you contributing to the greater community? Are you volunteering? Are you showing up to support different initiatives? And if you are just now learning, reach out to your school and ask about what programming they do. Right. Learn a little bit about what your children might be learning at school, and maybe you can learn alongside them. So wherever you are in your journey, I ask that you identify and take that next step. Keep that conversation going, because we're in it together.
Keep the conversation going. That's the key takeaway for this podcast. Dr. Lineman, I want to thank you so much for joining us today, giving us this valuable information, and then actually having a real conversation about suicide and suicide prevention, because I think a lot of folks will find this very insightful.
I appreciate it. Thank you for having me.
Thank you. All right, friends and families, this concludes our EDUCA DPS podcast for today. I want to thank our guest, Dr. Jane Lineman, for sharing this important information. I'd like to ask all of our audience members to please share this content if you know someone who is going through this. Please, they're not alone, you're not alone. Please share this content, and the resources are available. Don't forget to subscribe to our YouTube channel at Denver Public Schools Plus, where you can find great EDUCA content and all of our multimedia productions. You can also find us on all major podcast platforms. Just search for the Denver Public Schools Podcast Network. Leading in with gratitude, I want to thank the entire communications team for their added support, and a big thank you to our proud superintendent of Denver Public Schools, Dr. Alex Marrero, for his continued support to the EDUCA DPS podcast and all of our multimedia productions. Don't forget to tune in to our EDUCA DPS podcast, where the learning journey continues, and please remember to tell your children more often, I believe in you and I know you can do it. My name is Javier Ibarra. Until next time.